Novorad leads the field in augmented reality surgical navigation. With partners like the University of Utah, together they enhance patient outcomes by utilizing VisAR's groundbreaking technology.
I fell in love with neurosurgery a long time ago with the unknown frontier that the brain is. Problems arise that everyone's anatomy is different. Their skull sizes are different. External ventricular drains have been placed the same way for over 100 years. In our own study, we showed that using traditional landmarks, you could be over a centimeter off. Our traditional navigation systems that we use in the OR are huge to set up. Big footprints. When you're using two-dimensional images and applying it to a three-dimensional space, you have to plan bigger craniotomies, you have to adjust for the inaccuracies in the systems. Several years ago, I had a patient that I was treating, and we used our traditional anatomical landmarks and our neuronavigation to help localize where this lesion was, and got down to the tumor and couldn't find it. We were off. Our navigation was inaccurate, and the patient did fine, but just kept thinking that there's gotta be a better way. That's when I first learned about the VisAR system. I saw this technology first used in spine and now in cranial surgeries, and it's been incredible. Today we're treating a patient that's been afflicted with a radiation-induced meningioma. Now with the VisAR system that we have, we can map your images directly to your skull in surgery. The system allows us to plan incisions, it allows us to set landmarks. Your actual direct information is overlaid on our VisAR 3D hologram system, and we can use it in surgery to apply your images to your specific anatomy in real time. So after I speak to the patient, we are going to go to the VisAR planning system and plan the landmarks we need to register the system, as well as any landmarks that we're going to use to identify the tumor. These points can be used to register an image. You can essentially affix the hologram to a fixed frame once you use these points to merge. So any movement of the bed, any movement of the head or rotation, the hologram automatically will adjust. This is the footprint of the VisAR system. The images get directly downloaded to the headset. You can use it in an OR to be able to immediately see a patient's 3D images and plan a surgery. You can also have additional VisAR units in the OR, so two people can be using it at the same time to see the hologram from different angles. Show image. As we walk around, you can get a better view. We know that the tumor is on the left side. It's showing up on the left side. And it's almost like having X-ray vision, where you're basically looking through the brain and looking through the patient to be able to see exactly where the lesion is. So the superiormost aspect of the tumor is here. Drag, slice. Now I'm at the inferiormost aspect of the tumor. What we're going to want to do is make our craniotomy about a centimeter wider than what the border of the tumor is, and we'll plan our incision behind her hairline here. This, I think, gives us the best alignment as to where the tumor is. You can imagine with this procedure and this kind of technology, if you wanted to do contralateral approaches to lesions, or if you wanted to do mini terionals or some other keyhole type of approach, this is a way you can simulate that in your office, plan it out, discuss it with the patient, take it to the OR, deploy the plan exactly onto the patient's own anatomy. It takes a lot of the guesswork out. The VisAR system can be used to enter into many different hospital settings and be able to be used quickly using a cloud-based system. So I think it's going to open up navigation to a lot more patients. It's going to help with improving minimally invasive surgery for a lot of different indications.
The VisAR system is now FDA cleared for both preoperative and intraoperative use.